Discover the keys to a smooth recovery and improved mobility after hip or knee surgery. We'll explore essential post-operative care tips, ensuring you enjoy a healthier future with your new joint. To start, we will explore the following topics in this presentation: what to expect with your surgical wound, dressing and wound care instructions, post-operative X-rays and follow-up visits, activity guidelines after surgery, and when to contact the office. What to expect with your surgical wound. Feeling warmth at your surgical area is normal after surgery. This sensation can last several weeks, gradually improving. Mild warmth on its own isn't a sign of infection. It's part of the healing process. Bruising around the incision is common and may extend down the leg. Initially, it may look worse before it starts to improve. Typically, most bruising sees significant improvement within 2 to 4 weeks. Swelling is common after surgery and often increases with activity. Resting, elevating your leg, and allowing time can help reduce it. Keep in mind, some swelling may persist for several months after your procedure. Surgery affects small skin nerves, causing numbness around the incision. Sensation typically improves over months. While some numbness might be permanent, it's generally harmless. Remember, this is a normal part of healing. Dressing and wound care instructions. Here are your dressing instructions. Leave the dressing in place for 2 weeks. Keep it clean and dry. Do not remove the dressing at home unless instructed. This helps protect your incision as it heals. In addition, do not ignore excessive drainage from a wound or dressing. Contact the office if the dressing becomes more than halfway saturated with fluid. Turning to post-operative X-rays and visits. X-rays are taken at every routine post-operative visit to aid in recovery. Routine visits are typically scheduled at 2 weeks after surgery. They occur again at 6 weeks post-surgery. Additional visits are usually planned for 4 months and 1 year following surgery. Activity guidelines after surgery. You can resume driving 2 weeks after surgery, provided certain conditions are met. Make sure you're no longer taking narcotic pain meds. Also, be confident in your ability to stop quickly before getting back behind the wheel. Avoid traveling for 6 weeks after surgery to minimize complications. If you absolutely need to travel, discuss your plans with your surgical team for tailored advice. Swimming and baths can be resumed at 6 weeks if your incision is fully healed. Make sure the wound is completely healed before you swim or bathe. Steer clear of pools, hot tubs, and baths during the first 6 weeks post-surgery. Increase your physical activity gradually over 3 to 4 months. Listen to your body to gauge both progress and setbacks. Always avoid pushing through any pain during your activities. Finally, if you experience worsening symptoms like increased pain, swelling, or drainage, contact the office. Reach out if you have a fever or any concerns about potential infections. It's crucial to keep your healthcare team informed. As we come to the end, let's recall key points. Contact the office if the dressing is overly saturated. Avoid travel for 6 weeks due to risks. Driving resumes at 2 weeks if conditions permit. Return to full activity gradually at 3 to 4 months. You've learned essential tips for a safe recovery.